Taiwan has more than 80,000 patients undergoing kidney dialysis, making the incidence of this disease the highest density in the world. Research has found only 30% of people undergoing dialysis can survive 10 years, while 75% of kidney transplant patients can survive 10 years without problems, indicating a need for organ transplants for dialysis patients. However, even if a successful match is made, those who accept a liver, kidney, heart, or lungs must take anti-rejection drugs for the rest of their life. This drug lowers their immunity to disease, as they must work hard to maintain good physical and mental health. Here's more about the difficult life many organ transplant patients must undergo as they are given a second chance at rebirth.
The transplant medical team is highly focused on the surgery, paying special attention to all the details associated with the life and death of the patient.
Liver necrosis, or even that of the heart, is more urgent. Lungs transplants are very urgent.
Organ failure and fear of death is something that Mr. Zhang experienced. Liver cirrhosis and liver cancer put his life in danger.
After removing a tumor from liver, it reappeared again like grapes.
Time is pressing as physician says some 2,000 people are waiting for organ donation. We went back and told our children and they said they were all willing to donate.
At the time, the family's 26-year-old youngest daughter volunteered to donate her liver.
After donating part of my liver, after 6 months, my liver recovered and became even healthier than before, and I didn't feel that my strength was poor. I can even move heavy objects.
Within the human body, the only organ that can regenerate is the liver. As long as 1/3 of the original liver exists, it will be able to regenerate to its original appearance. But patients receiving liver transplants can frequently experience liver rejection.
Assuming that I transplant my organ into your body, of course your immune system will go and attack the organ, making it lose its function. So we must give patients anti-rejection drugs. I have to take long-acting anti-rejection drugs twice a day. They last for 12 hours at a time.
After taking anti-rejection drugs, the body's resistance to infections is not very good, so the patient must pay more attention to health than ordinary people.
In order to improve his immunity, Mr. Zhang regularly exercises. In addition to maintaining his body's regular function, he tries to be in a happy mood, as this too is an element of health. After getting a liver transplant, Mr. Zhang began to learn calligraphy. He is now the Secretary General of the Daja Calligraphy Association. Few people know that he was virtually reborn after being critically ill, waiting for a liver.
After changing my liver, I was given a new Mercedes-Benz logo.
Opening his shirt reveals 3 obvious surgical scars, which his daughter also shares. His daughter says this is a mark of love. It's very painful, but worth it.
At that time, I wasn't psychologically prepared for my father leaving, but now I feel good that my father is still around.
After changing the liver, 10 years were added to this life, which feels like a gift.
After getting a new liver, I have gotten more than 10 years of happiness. My husband and family have been together and healthy every day. This has made me truly grateful.
In 2015, in Taiwan, there are more than 500 liver transplants and more than 100 kidney transplants. These surgeries mainly involve donations by family members, but not all such pairings are successful. Mr. Xie urgently needed a kidney transplant as he awaited a donor.
Registering and waiting for a kidney transplant is more difficult than winning the lottery.
The waiting time for such a donation stretches into the foreseeable future unless major changes in policy are made. On October 1st, 2015, the Ministry of Health and Welfare revised regulations for waiting for a transplant patient, with those who have a relative being a donor making the individual gain priority. Taiwan currently has 90 such families on the priority list. Mr. Xie is fortunate, as his brother 7 years ago suddenly died of a cerebral hemorrhage and became an organ donor.
I remember that after registering for an organ donation within a week, I got a phone call which said that they found a kidney which matched. I had to do dialysis on Monday, Wednesday, and Friday at the hospital, and my physical strength was also very poor. After the transplant, my life has become quite normal, and I have even gone abroad 7 or 8 times.
According to data from the National Health Insurance Bureau, the 5-year survival rate for those who do dialysis is 56%, while that of a kidney transplant is 90%. Over a longer period of time, such as 10 years, the survival rate for dialysis is just 30%, while for transplants, it is 75%. There are only about 100 kidney transplant surgeries in Taiwan each year, with more than 80,000 domestic patients going for dialysis. This means that less than 0.13% get a transplant.
Kidney transplant survival rate is quite high. Of course, the heart, liver, lung recipients have more difficulty. The 3 to 5 year survival rate is now 50 to 70%.
After the kidney transplant, Mr. Xie and his mother joined the ranks of volunteers for organ transplant to help repay this gift.
If it lets people live longer, this is definitely a good thing.
Helping critically ill patients live longer, organ transplants is something that more people should know about, overcoming the fear of such procedures and potentially helping others live a better life.